Welcome back to the Relentless Podcast, where I'm always trying to have conversations that will help you thrive in your physical, mental, and emotional well-being. And I'm a licensed massage and bodywork therapist, so my day-to-day in and out is stress management. And there's a few big tickers we all know that get a lot of stress started in ourselves and our family, finances, religion, and children and babies. And that's what we're going to talk about today. Because the better we can manage that season of life, the better our stress level is going to be, and the better our lived experience is going to be. So today I have with me Bri Kurcsak, and she's an occupational therapist. We're going to talk about many avenues of childhood, starting as a newborn, moving into toddler and adolescence, with different problems you might experience and face with your child's health. She's going to walk through each of those stages with us, but not only that, she's going to share with us her story and how, as with so many people that I talked to in the health space, got into the industry because of experiences that they had, where it promoted them to do even more deep diving into that field that they're specializing in. So Bri, welcome to the podcast.
Thank you so much for having me. It's great.
Absolutely. And so you're an occupational therapist. Yep. Specializing in children. So can you give us kind of a breakdown of your history of your education and exactly what it is you specialize in?
Yeah. So I have a master's in occupational therapy, and I always knew coming out of grad school, I initially went into the field wanting to work in pediatrics, kind of, bounced around ICU, spinal cord injuries, worked with adults, loved every minute of it. And then kind of fell backwards into pediatrics. And I worked, a lot of sensory, a lot of autism, just kind of saw the gamut, fine motor, shoe tying. And I just quickly fell in love with the aspect of feeding. And, we eat 3, 6, 10 times a day. And it's such a trigger for families. It can be so stressful for parents. And so I really fell in love with, feeding and just wanting to help families teach their kids to eat better and to figure out, why are these kiddos struggling? And it's like, I became a mom and my worlds collided with, I thought I knew. I always say I didn't eat a piece of humble pie, I ate the humble bakery. Like I really thought, I left that hospital, got in the back seat, and I was like, I thought I knew everything about peds. What the heck? And I knew nothing. And my boys have taught me so much, and they have been kind of my driving force in learning and just not taking no for an answer and not stopping. So my youngest really struggled with some sleep issues. He had a history of seizures. We had a lot going on medically. My oldest, chronic ear infections, like he had 76 doctor's visits his first year of life, 7 hospital stays. And it was just, taking the traditional approaches, it's just unlucky. It's daycare germs, a lot of myths that I'm like, this doesn't add up. This isn't right. Like, we're eating good, we're sleeping good. So I thought. And so I just kind of worked my way backwards into the lifespan of, working with older kids for what I thought was, quote, picky eating. And then had my own kiddos with challenges for breast and bottle feeding. And then it became a sleep issue. And then it became a chronic illness issue. And it's just like, I kept making left turns, learning through them. And ultimately, it's just put me down a path that I'm on a mission. And, eating, sleeping, pooping, it's 3 areas that parents struggle so much with their kiddos, and it's not talked about. If you're a breastfeeding mom struggling, don't talk about it. Go get help under wrap, but don't say, hey, I'm struggling. And I think now social media, the internet, podcasting, a lot people are getting more comfortable saying, hey, I struggled with that, or hey, go see Bri. Hey, go see this person. It's a lot of word of mouth. And so just a lot of my own struggles as a mom really led me down this path. So I have my own private practice here in Charlotte, North Carolina. I see kiddos in clinic. I see kiddos virtually from all over the place. I'm a part of the Medical Academy Pediatric Special Needs. I joined that group after becoming a PANS Pandas mom, and really I'm an advocate for the MedMaps team because it's a bunch of individuals just driven to bust myths and to get these kids help. So it's been kind of a long, wild journey. And if you would have asked me 10 years ago if I would be here, I'm like, no, I'm just going to be seeing kids for picky eating and shoe tying and handwriting. And here we are.
Well, I love everything you said. And that's exactly, it's so funny how people like us find each other, especially online. We live in Charlotte, we're in the same city, but we're not in the same exact spot, but we're reading each other's stuff in the comments that we're making, in the posts that we're making. And we're like, okay, we vibe 100%. Like,
Yeah.
and it's always that journey of when you really are interested on how the body and the brain work, and you choose to take that deep dive, you figure out really quick that the body doesn't do a symptom on accident.
No.
The body doesn't present a thing that's outside of the norm just because.
Right.
And that's the mishap, and what's missed so much in the blanket Western medicine term is they're just treating symptoms, which sometimes that's great. But when you start to take that deep dive like you did of why we're doing so many right things, of course, none of us ever do all things correctly,
Yeah.
but we're doing so many right things and we're still having this plethora of symptomology that can't be answered with the things we're actually doing that we're told to do to fix it.
Right. The ultimate stop for me was a message from a physician saying, you know what, I think this is a parenting issue. I think this is your anxiety. And I was like, my kid is waking 8 to 10 times a night. I've built beds. I've shared beds. We've moved beds. We play musical beds. You're telling me my son waking up 6 to 8 to 10 times a night. This isn't behavioral. Like, we've punished, we've taken away, we bribed, we bought every clock, every light up. We bought everything. There is something wrong. And when his sleep study came back, having over 200 arousals in the night, over 200 arousals, I sent the results and there was nothing said. Like, I don't know if I believe those in-home studies. I was like, we're done here. We're absolutely done. And now I'm going to run and I'm not stopping until I have answers, because this explains, no wonder he's tired. No wonder he's irritable during the day. No wonder he's having some behavioral challenges. He wasn't a behavior problem. He was tired.
Mm-hmm. And that's a huge point for everyone to get, no matter how old you are, if you have kids, not kids, whatever. Your body being in an anxious state is your nervous system letting you know something isn't okay.
Yeah.
And so your answer that you got was it was parenting or you're on stress. Like, that is such a common thing that we as women get anyway. Yep. So if that is if that's the end of the road for your physician, it means they don't know the right questions to ask. Right. So I'm so glad that you didn't take that for an answer. No. So with our parents that we're talking to and trying to help, let's start from the very beginning, because we're going to get into each stage and signs and how we can help. But from that, coming home from the hospital as a newborn, what are some signs that we can start seeing where, okay, I need to intervene here? Because that's the thing, is we just suspect our babies to be cranky and unhappy as a newborn, but there's, I'm sure, some specific things. And by the way, we need to mention your t-shirt. I love your shirt. So I do craniosacral therapy. So jaw, tongue alignment, how the lips close, how everything is, lined up in here, and abilities of it to move. It's just, like I said, we align on so many things. Yeah. But going back to bringing that newborn home from the hospital within the first weeks, couple months, what are some things you can help us to look for if we're that new mother?
So something that's really fascinating, and it's starting to get more attention, that we are finding that moms with sleep disordered breathing or obstructive sleep apnea or poor sleep, that oxygen intake, if they're not getting it, that baby's not getting it. So if that baby's not getting the oxygen in utero from mom having disrupted or dysfunctional sleep, that is impacting baby's suck-swallow coordination. Like, they are in that uterus. We want them moving. We want them sucking. We want them swallowing. They're practicing to come out into this world and to showcase their skills. So for moms, it's often when they're bringing their baby to me, and as the gears get turning, you can see mom and dad going like, oh gosh, I was in speech therapy, or, oh gosh, I don't sleep well. And it's funny because, I know you do this too. They walk in and I can immediately look at them structurally. We were just talking before we hopped on what's happening on social media where, myofunctional therapists and providers are looking at a photo or taking kind of a celebrity and looking at case studies. These parents walk in my room and I'm like, oh, apple tree, apple. Like, it doesn't.
Right.
And so a lot of times, it's very validating. I joke that I buy like the expensive Kleenexes because oftentimes I get parents that are they're crumbling. They're coming in. If they're not already in a place of, they know, we've identified either a tongue tie or oral restrictions, tethered oral tissues, or they're saying, I'm watching TikTok, I'm watching Instagram. I saw your post about signs of a baby struggling. That's why we're here. So I often bring parents kind of all the way back to the beginning. I explain those suck swallow reflexes that are being built in utero. So what happens if a baby is tongue tied? That is when I've got my awesome little tongue and mouth here. So if that tongue is restricted here underneath, okay, it's pulling down into the floor of the mouth. And what happens is that's creating open mouth breathing. It's also creating, from a suck standpoint, if a baby is learning to suck with a restriction in the back of their tongue or anywhere on the tongue, they're not getting a big wave. They are getting a flutter. So symptoms that we're going to see with babies and signs of dysfunction is, the classic, their colic. I do not jive with that term. I don't buy it. I don't believe it. There's a reason why this baby's struggling. Let's figure it out together. So what can happen if that tongue is restricted of any sort, or even if there is no tongue tie and they just didn't pick up some coordination? What's going to happen is that tongue's going to sit low. It's going to work in a flutter motion instead of a wave motion. And then what's going to happen is the baby's going to fatigue. So we're going to see they're putzing out early at the breast. They just don't have that stamina or the endurance. They are going to be the kiddo that gets frustrated. The minute that letdown slows, they don't have enough, oomph to kind of keep going and to keep building that milk supply. So they pull off. They appear done. We're also going to see things like they're frustrated on the breast or on the bottle, or we're hearing things like they can't breastfeed, or my baby can't take a bottle. They might be really refluxy. They might be spitting up, or they might not be spitting up. They might just be arching. They might be tense. You see that? You're seeing that tension head to toe. Mm-hmm. So when a baby is not sinking into a good rhythm of feeding, they're good awake times, floor time, then good naps during the day, good nighttime sleep. If your baby's out of that rhythm, there's a reason why, and we need to figure that out. So a lot of times we get these myths of, that's clicking is normal. That reflux is normal. Babies are supposed to be gassy. They'll grow out of it later. If your gut feeling as a mom or dad says, something's off about this, my baby's just not the same as my friends or my previous baby, get it looked at. We need to figure out why. And that doesn't mean even if we find a tongue tie or a lip tie or cheek ties, buccal ties, it doesn't mean we're running off to get those ties released. A lot of people function with a tongue tie, with a lip tie, but we want their feeding to develop and progress appropriately because that establishes lifelong feeding habits, lifelong breathing, lifelong speech. It's our entire facial structure and airway.
You said something very important there when families are looking and seeing these things. And I'm so thankful again that we have mass education on social media available to us. But when they're starting to see these little signs and things that this should happen, feeding should happen easily and normally.
Right.
If you go to a professional, that doesn't necessarily mean you're going to get good information. Because right. Just like with menopause care, with so many other things, our professionals haven't necessarily come along with the changing understanding of how the anatomy works. I mean, if you listen to any podcast with a neuroscientist, if they're saying they don't really know everything about the brain yet, you can't tell me we know everything about just this part of the body on the outside yet. So you're an advocate, I'm sure, for having people say, listen, go get a second or third opinion.
Yeah. I always say, I'm kind of a myth buster. I get, stuck in turf wars a lot of times because we've seen 7 professionals and they said our baby wasn't tongue tied. They just can't breastfeed. Or, I was told it's genetic. My grandfather snores, my father snores, I snore. That's just snoring is just habitual in our family. Or we all have a dimple here in our lower chin. That's just the Smith dimple. There's a lot of myth busting that I often have to say, well, yep, genetics can play a part of this, but we also want to look at the bigger picture of function for the life. Like, we don't want it's not just about breast or bottle feeding. I want your kiddo to be set up for lifelong airway development and lifelong good feeding.
Something I think, again, is really important for people to get is I think we need to make an educated approach to the public that the word genetic versus familial are two different things. There are very, very few diseases that you will absolutely have because of your genetics. Right. There are many, many pathologies or symptomologies that you will have because interventions weren't done. And your family habits and lifestyle choices. So that always gets me too. I hear that a lot with my clients, and fibromyalgia even. It's genetic. Everybody has it. Type 2 diabetes is genetic. No, these things aren't genetic. So I'm glad you're on the myth busting thing. So, well, let's go.
11 million kids in the United States have sleep problems. And that's honestly, like you said, that's how we connected over, being in different mom groups and internet groups and things of the normalization. You've got 40 comments on a post about, oh, my kid's a restless sleeper. And it's just, oh, mine too. Bedwetting. My doctor said they'll grow out of it. Oh, we heard that's genetic. My husband did it till he was 10. So we're not going to worry about it till 10. 25 to 50% of babies over the age of 6 months old are still having night waking. That's not good.
Right. So question something I saw, I think this came out, I don't know, my timing is, because everything is so fast and furious in the medical world. The CDC changed the guidelines for when you should see certain milestones reached. Do you remember they did that?
Yep.
What is your thoughts on that?
I mean, the fact that crawling was taken out of it, I always say it's like job security for me for the rest of my life. The fact that we're taking crawling out and we're delaying, speech norms were delayed, crawling was removed. I struggle with that as a whole. Now, I tell everybody, I have one kiddo who walked at 13 and a half, almost 14 months, and I have one kiddo who walked at 10 months. Don't you think I was not texting all of my PT friends, panicked about, do I bring him into PT? He's late. Late or early is relative. What does their developmental picture look like before, during, and after? So for kiddos, parents oftentimes compare, oh my gosh, well, my other kid walked at 9 months, so why is my second child not? Their development may look completely different. I'm very big on, I'm less about the windows and the norms and the averages and more about, well, okay, has your kiddo been crawling for 5 months and we're not pulling up to stand, we're not getting up to walk? Or, okay, so your baby's 8 months old and they're not sitting upright. Well, are they rolling back to belly, belly to back? Are they trying to get up into some prop sitting? Did they do tummy time? So, it's funny because I always hear like, what baby likes tummy time? I need your baby to love tummy time. That is the most important developmental position a baby can be in. So when I'm hearing, our norms, the CDC is bumping these age ranges back or eliminating milestones, I'm going, wait, that's part of our physiological development. Why are we taking that away? So I try to really educate, parents. If I'm seeing them as newbies, I get them at 3, 4, 5 days old. I'm mapping out, I'm not worried about their sitting and crawling that young, but I'm mapping out, hey, here's what I want you to work on for the next 30 days. Okay, so your babe's not loving tummy time. We need to get into some side lying so that their neck can soften up and tolerate the position of tummy time. And really, I pride myself a lot on just educating parents to say, let's look at your child individually, where they're at, and what milestones we're setting for them kind of as a team, keeping their motivation, their abilities in mind, not what everyone else is setting.
So important. I mean, so important that as treating adults, that's some of the questions in my questionnaire, because it lets me know how long their system has been under stress. And why sometimes they are presenting with constant anxiety. When anyone says to me, I've been this way since I was a kid, there's some contributing factor to their developmental process. Absolutely. And yes, to take crawling away as a standard and as a milestone, that is when you begin to develop how to load the ligaments and joints, and you get the fascial lines of the body strong enough to do the next thing. So to remove that, to me, I was flabbergasted when I saw that.
Oh, yeah.
Really,
I shook my head and I was like, are you kidding me? I mean, it's anyone who studies development or the body head to toe knows that crawling is one of the most important things a kid can do in the first year of life. And there's so much too of just, oh, it's automatic. That development should just be learned. But if a kiddo is not crawling or not walking, they'll usually get sent to physical therapy. What about a kid not eating? Food before one is just for fun. That's my number one myth that I scream over. Food before one is for learning, is for teaching. Volume and repertoire, I'm less worried about. But the skills, we are missing vital windows because, in my opinion, of fads where, people are jumping on bandwagons and they're not doing the basics of tummy time, crawling, feeding development in that first year of life. And it comes back. When I get a kiddo that's 4, 5, 6, 8, 9, 10, first thing I ask the parents, they don't remember their first year of life, right? They tune that out. They're tired. It probably was not a great time for them. But I say, was your baby a high needs baby? Yeah, I could never put him down. They were so uncomfortable. They would spit up everywhere or they would cry being put on the floor. So these babies that have a nervous system that is frazzled in the first 6 months of life, we need to see them. Those are the kids we can redirect. They're not broken. They just need some support. And that is, like you said, we as humans, we compensate. That is what we know to do. So if we can't complete a task, we compensate through the task. And we see it. You see it. You see it in the adult population.
100%. So going back to that newborn, so you mentioned tongue tie, lip tie, buckle tie, jaw ties. So explain to the person that's never heard that before or just heard it and repeated it without knowing what it is, actually what's going on with the tissue and the fascia and why that's so extremely important to development over the lifespan of that human body.
Yep. So ties can be formed usually by 16 weeks in utero. So we are this big, itty bitty in utero. And if we have developed a lip tie, tongue tie, buckle ties, lower lip tie, we can be tied in 7 places. Now, it goes back to, is this genetic? Is it part of the MTHFR mutation? The research is still out of why are ties forming? Why are we seeing a high volume of ties? Why am I seeing kids tighter and tighter and tighter? I will tell you, I did not see the kids this tight 10 years ago. They they existed, but not in the number, not in the volume. So, is it the external or environmental stressors? There's lots of theories about what creates a tie. So we all have a frenulum or frenum, interchangeable words. So those bands underneath the tongue that attach the tongue to the floor of the mouth, that attach the upper lip, and then cheek ties can be our dimples. We all have frenums in our mouth. It's at what point do those attach and at what point do those cause restriction? So I will get kiddos that have the worst looking, most restricted ties, and they have beautiful function. On the other side, I get kiddos that we've been told this was a mild tie. Oh yeah, we don't have to worry about it. They can still flange the upper lip and get that nice duckbill latch, or their tongue seems to be moving well. We never judge tissue based on the visibility and the look of it. We base it on the function. So what happens if those ties are formed in that first trimester of pregnancy? That baby is often growing tight in utero. So we see typically less movement, or we see lots of intense movement because these kiddos are they should have free movement. Those necks should be moving. So I like to say to parents, what'd your ultrasound photos look like? Did you get a lot of this? Could you see? If you couldn't see baby's face, this is why. This is that fascial pool, that restriction through the whole body. So we have a fascial line that runs from our tongue all the way to our big toes. And what will happen is if we have restriction in the mouth and that tongue is not waving this way, we start recruiting. So we start pulling tightness through here, these are the babies I call my no-neck babies. They come in and they just look like this. They're cute as a dang button. They got 7 extra chins. They cannot bring those shoulders down and they can't open up. So that's going to create a huge impact in breastfeeding, right? You put baby at your breast and they're like this, that milk is spraying at them and they're just like they can't take it. So what they'll often do is they'll hump the tongue up to protect their airway, and then they're pulling off in resistance, or they're coughing or choking. So when that neck is tight, those no-neck babes are here. It pulls their diaphragm, which is their breathing muscle, up high and tight, pulls all of their digestive tissues, everything that's going on through our digestion in our hips, all of that gets pulled up. So it's like we put a little baby on a marionette string and we just pulled it taut at the top. So we now have oral tightness, we have neck tension, we have diaphragm tension, we have tension through the hips. Those are the babies that struggle to put their legs down during a diaper change. They stay all crunched up and you're like, I can't get in all the nooks and crannies. And then their toes either look like this or like this. So they splay them. They look like they're pressing a gas and a brake pedal, or they're curling them. And they've got their shoulders up. They've got their hands in high and tight. Now, we all know that tight hands, sign of a hungry baby. What happens after your baby's fully fed? I want to see those toes relax. I want to see those hands relax. So if we're seeing this, or you're saying to me, I got some extra chins, or we can't wash in the neck during bath time, we need to check that tightness. And it starts here. It starts in the mouth. So a lot of times I'll get babes that we had torticollis or we had a cranial band. Well, did anyone check the mouth? Because the mouth, that tongue, which is why I love my tongue shirt, our tongue is our center hub. That's our nervous system regulation. That's our breathing. That's our feeding. So if that tongue has restrictions of any type, it's going to latch onto something. It's going to pull us into rotation. It's going to pull us into a tilt. It's going to shift our hips. It's going to create tension. And then in a baby with tension, they can't get into relaxation. So what do they want? They want to be held. They want to be upright. They don't want to lay. We hold them upright. And what does it do? It reinforces all of that flexion, that tension posture.
I'm just like, yes. And my adults, one of the phrases I always use with my adults, so we are just big babies.
We are.
Especially with something like this.
Yep.
If you didn't have an intervention with all of these things, my 30, 40, 50-year-old clients, you're still presenting with pain and anxiety and muscle, skeletal system pain, bone, joint pain because of this. So that fetal position those babies are stuck in, my clients are sleeping in every night because it feels more comfortable.
Sure does.
And hyperkyphosis, the rounding of the shoulders and forward head that usually we see in the elderly, we're having in our 20s and 30s. And with that never treated properly, because just one massage, which is what I do, or just one chiropractic adjustment is not going to fix this.
No.
So if
I see so many babies that it's funny. I bought a bigger mirror so that parents, when they start kind of like connecting the dots and, they're excited and they're like, oh my gosh, this explains it. And I feel so validated. And this explains me. And can you check to see if I'm tight? I'm like, sure. And I need to go back and run the numbers, but probably over 24 parents that have pursued this myofunctional therapy world, this tongue tie world, because they realize, oh my gosh, I'm going to consistent therapy or massages or chiropractor because my neck is just always out. I have a friend who was released and did all of the work and did everything in the perfect pattern. And he's feeling 10 years younger following therapy, body work, a tongue tie release. I mean, having high cholesterol or being overweight or chronic pain, it's a lot of, I sit at a desk all day and I'm typing or I'm on my phone or on my laptop, but it goes back to the tongue. It goes back to our resting posture of our tongue and our airway. That is what sets the stage of lifelong alignment or malalignment.
And with that adult that you're just talking about, I do these things and I blame it on the computer, I blame it on the phone, I blame whatever. Just like with the baby, you can go back to, do I know another adult in my world that is doing all those same things that I'm doing and they don't have pain or they don't have these issues? Yeah. And that kind of gives you a tell. I always say you have more in your soup mixture than just sitting at your desk for a living or just being on your phone, because I have clients, they sit at a desk for 8 to 10 hours a day and they have zero pain.
Yep.
So when you're not able to do regular human common day stuff without chronic pain or other issues, breathing, heart, like can you even get a good breath when everything's squished up like that? No. So obviously you're going to be anxious. If you're doing regular worldly life things and you're having all these symptoms, we got to go back to the beginning sometimes. So just to wrap up the tongue tie thing, my son had a tongue tie and he had trouble latching, trouble nursing right away. And I didn't know all this that I know now back then. So I don't remember exactly the verbiage they used, but it was very, very evident to me as the mother. And then as soon as he had his tongue tie release, good to go. Everything was great. So explain to people, where do you start to say, okay, we actually do need an intervention here? Because just like you were saying earlier, it's not always necessary that you need a tongue tie. The body is so resilient and able to change and adapt and grow. And especially when you're that young, because you have all those cellular properties running through your body that want to go to the places where it's needed and heal tissue that needs to be more lengthened or whatever. So kind of give us an idea of when is it actually, yes, for sure, we need this intervention, how they're different now because they were done differently probably than my 20-year-old had done. And then like what it looks like to say, we don't really need to do that severe of an intervention. We can do more myofunctional type things with each individual child.
Right. So it's so individual. It's so unique to that kiddo. I ran my numbers from last August. I need to do like a spring, update of the 100% of kids that I identified a tongue tie in. 70% did not need released. Only 30% we sent out for release. So I'm very big on, there's plenty of places you can go and you can call and get a release that day. It's kind of like a car wash or an oil change. Like you can get it done if you want it done. I just want to shout from the rooftops to say, find a professional that is highly trained in this area, because I get a lot of calls. We've already had our frenectomy and now my baby's not eating. We got a frenectomy a couple weeks ago. Feeding is worse. I lost them breastfeeding. Or we had a frenectomy and now sleep is worse for a toddler or an older kid. There's reasons why we as therapists exist. There's myofunctional therapists. Like we're trained in this. So as an occupational therapist, as a feeding therapist, I'm prepping kiddos and I'm meeting the parents where they are. If they come into me, they have worked with a lactation consultant, they are, they're knowledgeable, they feel really good about it. I'm saying, let's set a deadline together. It might be 7 days, it might be 10 days, it might be 14 days. I want you to do these targeted exercises that I'm going to teach you to help stretch out the mouth or help activate muscles that are just chilling out, not doing their job. So a lot of times tightness, where there's tightness, there's weakness. So sometimes we need to cool the jets on some tight muscles and get going with some of the weak muscles that are just kind of hiding out in the background. So it's so individualized. I wish I had like a recipe book. I say to parents, there's 100 ways to make chocolate chip cookies. You put a cup of flour, I put a half a cup, I put 3/4 a cup of this. There's no exact measurement or deadline to say you absolutely need a release. I have a kid right now that I'm seeing. He has the worst, most restricted tie I have ever seen in my career. I do not know how this child is eating, and he breastfeeds, bottle feeds beautifully, and he is sleeping, tongue suctioned, lips closed, nasal breathing. I don't know how, but these parents are so invested in the lifelong process of this. I'm not going to see him for therapy for life, but he's turning 6 months. I said, let's revisit this on solids and determine. They think, hey, I think we want to go through with a release to set him up for solid success and breathing and speech success. But he's been doing so well. His body is soft. He loves tummy time. He's rolling. Why would we interrupt that? So every case is so unique. My number one thing would be to say, please do not just race off and go get a frenectomy. Work with a professional, whether it's lactation, a feeding therapist, OT, speech, whoever it is who's highly trained in this. Let them walk you through the process. There's a lot of, courses and education coming to the forefront. There's a lot of information on social media. Find someone who's done this for a long time. 5 years ago, I admit our training was, if you're tied, go get it done. What are you waiting on? We rushed them. And as, time has progressed, even just in the last 5 to 7 years, I've said, wait a minute, not everybody needs this. Can we gain function and regulation of that nervous system? Can we get that fascia to stop being in such a tense, a constant state? Can we get them to soften without the release? But find a practitioner who's going to walk you through the pros and cons. If I have a family leave my office who they've not gone through with a release, whether they're choosing not to or I'm not recommending, we're not recommending together as a team, I'm giving them this is what you're looking for at 6 months. I want to see you back by 1 year. I want to check your solid feeding. If they leave my office at 1, I'm saying, I'm kind of like the dentist. I need to see you yearly, or you're going to be watching out for these 10 symptoms or this, checklist of 6 things. I make sure kiddos leave my office with parents knowing this is what we're going to watch out for. And we're going to text Bri if we see something otherwise. I don't want to see your baby and then you come back to me at 5 years old and we have all sorts of issues, because now it's snowballed and you're stuck. I always say to them, you're stuck with me for a really long time at that point. So let's stay on it early and kind of know, what pros and cons, because if a baby is struggling, a release doesn't always just make them not struggle. It can make them struggle even more. I've seen kiddos, moms have lost breastfeeding because they got a release. The kid had no training beforehand. They come out of that release with all this movement. They don't know what to do with it. They're panicked, they're stressed, and they're like not doing the breast. So it's important to be walked through the process with a team, with somebody you trust, and not just, oh, wait, I think my baby's tied. Everyone said they're not. I'm just going to go release, because it can be a lot harder afterwards.
Again, love it, love it, love it. And to put a little pin on, this is what actually medicine looks like for people. I'm going to say that very intently, because if you go to get care for yourself, your infant, whoever, and you're basically given this blueprint of this is what we do when you have this and this, that is not practicing healthcare, which is why I love you and your philosophy, because it can be a different thing for every person. For me, someone that comes in with shoulder pain or a frozen shoulder, they all got it in 50 different ways. And the answer isn't going to be the same for everyone. So I love, love, love that you look at each individual child, which is where I think a lot of like functional medicine and alternative care, that's where we're going back to, is the actual individual, because you're exactly right. Doing an intervention doesn't equal an outcome. And one of my mentors used to always say, if we do some type of release, or you can insert whatever kind of thing you want to do, chiropractic, massage, whatever, and the proper steps weren't taken to address where the weak patterns were, what's going to happen when that client gets up off the table? Everything around that, or that thing, if it's still there, is going to tighten up quick, fast, and in a hurry. Which is why you can have that experience of, well, we did the thing you told us to do, and now they're actually worse. So just reinforcing to everyone, make sure you're with a qualified practitioner that gives you the full story and does a really comprehensive intake and exam of what your child actually needs. So I love that. And then can you differentiate a little bit? I know there were laser treatments, and then it's different what that looks like for people, because in the event that they're needed, they're amazing and they are helpful. Going back to the adults that I've dealt with, like you said earlier, some of them that have had severe ones that were never dealt with, and they have extreme hyperkyphosis and forward head posture that no amount of massage or chiropractic is going to undo. They have reported to me, and it makes sense when you understand the fascial lines of the body, but they said it felt like someone cut around their clavicle and peeled off a layer of their tissue, and they just feel open to the world and like a new person. So when it's needed, it's amazing. So differentiate a little bit about what the procedures look like.
Yeah, I've had families tell me, adults, I had a dad in particular say it felt like he took a backpack off of his back. Like the weight that was pulling down and forward had the release and just opened completely up. I mean, I have a baby right now that was just released last week. I saw him Friday. I didn't love how he looked. I'm like, can you come Saturday? They're from out of town. They drive, an hour and 15, 20 minutes in. I'm like, I'll see you in my home office. I'm treating him like right in my living room floor, because I'm like, no, we need to get on this. And this is crucial because we just had a release 3 days prior. So there's lots of different ways. I work with a lot of providers who release from, North Carolina. I have South Carolina providers that I refer to. But in a nutshell, like it can be a dentist performing with a laser. There's multiple different types of lasers, and there's multiple different types of techniques. So it's important. I also refer to providers that I refer based on the child, based on the family's needs. So if I have a mom that I know needs a lot of, bedside manner, a lot of support, I'm going to refer to a certain provider. If I have a family that's like, you know what? They're not trying to have dinner with this provider. They're not trying to be friends. They just need a really good frenectomy. I'm going to, refer to this provider over here. So lots of different options from a dental standpoint with that laser release. From an ENT or an oral surgeon or a periodontist, you're going to have a scissor release or a combination. Sometimes you'll get a laser release and suture, which is stitches after. There's a functional frenuloplasty that you stay awake during and you're active and actively lifting your tongue. I'm too chicken to participate in that. So there's lots of, whether it's a laser, whether it's a scalpel, whether it's scissors and sutures following, there can be a lot of, combinations, and it depends on who the release provider is and what their training is. So there's a provider on the West Coast that will use, scissors, a laser, and a scalpel, and he'll suture or not suture, and he's an ENT. So it really just depends on the tissue, which is why be guided by a provider who's going to walk you through that. I tell every family, I like for parents to walk into a frenectomy when they walk in saying, I've exhausted other options. I feel like we have dedicated time and energy to the therapy, needed beforehand, the pre-frenectomy work. And I feel really good about this. If you are walking into that office, no matter what, ENT, dentist, whoever's doing it, and you have reservation, walk out, delay it, pause it. The babies, they feel our stress as caregivers. They feel it. If you are nervous, of course, as a mom or a dad, a parent handing over your baby and walking out of that room and you hear them cry, it is stressful. I try to walk parents through that procedure and I'm on call for them. They know they can call me anytime that evening, middle of the night. I'm awake at the time. I'm there for them. This is not you just go get the procedure and go. But I try to walk them through exactly what's going to happen and exactly what to expect after. They may not want to feed right away. They may want a lot of skin to skin. For older kids, I've had kids, they're at dance class that afternoon, acting like nothing happened. And then I've had adults that are down and out on prescription pain meds for 48 hours saying that was worse than childbirth. So it really it's so unique and individualized of what the pain tolerance is, how much tissue, how much needs release. Some of these babes are getting a lot of tissue release. So it's important to see a provider who, again, I want somebody doing hundreds and hundreds of these with the best laser or the best set of scissors. I want them to be top notch. I always say I won't send to somebody I wouldn't let do my own tongue or let do my kids' tongues. So it can be done a lot of different ways and the timing can, I might get a kid, if they're failure to thrive, we've exhausted other options in 5 or 7 days. Let's do it. If we feel like that is the next best step. I'm never sending a kid for the release of those ties, the frenectomy or frenotomy. I'm never sending as let's just throw it at the wall and see if it sticks. No, it needs to be very well thought out and part of our plan.
Another very, very important point to make is if a mother is having trouble with their infant and you go to your standard pediatrician that's doing, watching your markers, giving your whatever care, and they recognize a tongue tie, I see a tongue tie, this absolute, you need to go have this taken care of. That's why, in my opinion, it is so important to put the brakes on. Yep. And insert someone like you as an occupational therapist to say, wait a minute, before we go to that drastic step, again, let's educate on the whole picture, because it's easy for us on the outside as practitioners for us to see a dysfunctional pattern, but we need that professional that's in the middle as that intermediary between the drastic interventions, because there's 100 different things that need to be looked at, done, cared for before you go to that. So I highly appreciate your specialty, and I hope that people will take from this, okay, even if I was told absolute, without a doubt, I have this thing, let me call in this person here that's the specialist in this. And not only because you're the specialist in it, but because you have chosen to build around you this circle of providers that you know to refer to. Yeah. Because again, if just that pediatrician or dentist says, go get a tongue tie, they have no relationship with those people. They haven't had clients come back to them for continued care because that's not their specialty. Right. To see how the work was done, to see how the aftercare was, rendered. So your position and your specialty is vastly needed. So thank you again for what you do.
I had to gain some thick skin because early on, I would give recommendations and parents wouldn't follow it. They would either leave my office, call, go get a release. And then I'm stuck kind of mopping up the mess when they're saying, my baby only took 7 ounces yesterday. I do a lot of weekend. I try not to. I don't want to, but I do a lot of Saturday and Sunday appointments. I'll meet you at the clinic. I had a dad one time that caused me to go in on a holiday, and I looked at him. He calls compulsively calling. I said, y'all got a frenectomy, didn't you? Yeah, and we're on our way to Levine because she's not taking enough ounces in and she's boycotting eating. I'm like, when did you do this? Were you going to tell me? And it'd been done 2 days prior and we haven't had wet diapers. I said, meet me at my office first. If I need to send you for direct admission, I will. But the point was, I gave you a plan. You didn't follow it. I respect you. You're the parents. You know what was best for her. But this wasn't a good outcome. And I was very clear on that during that visit. And so he followed every single thing I said from that point. We got this baby eating beautifully. It was a great success story in the end. But he will be the first one to say, do not race off and do this, because that is terrifying when your baby's not eating. So it's not something, or even, doing it to a bigger kid, that can be traumatic. It can be a stressful procedure, and it shouldn't be. We want you completely prepared and set up for absolute success for it.
100%. And again, like the correlations between adults and babies is like, it's exactly the same.
Yes.
As obviously, like I said, we're just big babies. Yep. Because I'll have someone come in and, like you said, as a provider and practitioner, over the course of your career, you become more confident in saying things very directly to people. For example, that just reminded me of this story. I had a gentleman come in who's probably mid to late 50s. And again, because, he's in the construction business, he thinks he's strong and able. Sure. And I do a couple of muscle tests, and I don't even have to do a muscle test, because when I look at his body laying face down on the table, it literally is like a skeleton with skin on it and zero glutes. Right. There is no function there. Right. And so he gets up, I'm like, okay, I can help you, but you got to start some rebuilding of this musculature. You should do this, this, and this to help that posterior chain be stronger, to hold the hips where they need to be. He was like, and I showed him a couple examples of things to do to activate the muscle. He's like, yeah, I'm not doing any of that. So I'm like, well, you're going to be having a hip, yes, that, but you're going to be having a hip replacement real soon, because this little guy's not going to hold up. You jump down off of a forklift too quick or turn a little bit sideways, yep, your hip's in trouble. Just so you know, I'm just saying. So yeah, I love that. And to being able to tell parents, listen, and we'll get into this a little bit more with other topics, because talking about children and childcare is like talking about religion and politics. It really... Oh, I know you know, yeah. but to be able to say, listen, based on my years of over decades of experience, yeah, it's not a belief thing. It's not we're not calling into question your desire or your intent behind care. We're saying biologically, I'm saying this joint can't function if all the muscles surrounding it aren't working. And you're saying, yes, we have this thing that your child has, but if you do this severe intervention without these steps before it, just telling you what I see and know about the biology, yes, and yeah, of course you're welcome to make your own decisions, but what we're learning, what you're saying is, there's a reason we are the specialists, because we see these things and we see them over and over, and biology doesn't change. It functions in very specific ways. When we see hiccups in expressions or ability or function, then we got to go back and correct that biology. So here's a big one for you. Oh, are you ready? I'm ready for it. Pacifiers.
I love them and I hate them. There is a wonderful speech therapist in South Carolina, Autumn Henning, with Chrysalis Orofacial. Her statement of pacifiers should pacify, not occupy. I'm like, amen. Amen. The minute she said that, I took her training and I've become friends with her, and I think the world of her. And she said it, and I'm like, oh my gosh, I use that all the time, and I give her credit every single time I use it. I think pacifiers can be great to do just that, to pacify. I don't want a sleeping baby with a pacifier in their mouth. I need that to soothe them when they're upset. Beyond that, get it out. I don't want it in there. People will say, okay, well then, do you want them thumb sucking or finger sucking? No, I don't. I want their tongue suctioned to the roof of the mouth. So at night, I'm going to get my little model. At night, we want that tongue up and suctioned. We don't want that tongue laying low. So in a baby, I don't want to see any mouth breathing, open mouth catching flies. I don't want to see it. I don't want to see that in any age. So long-term passy use, the American Academy of Pediatric Dentistry, like American Academy of Pediatrics, it's been kind of a buzzy topic lately. They've been throwing around, hey, 6-month recommendation, pull it at 6 months. We want it gone as early as possible. I tell all parents, especially for kiddos that have oral restrictions, whether they've had a frenectomy or not, get the pacifier out. Now, can pacifiers be protective and helpful in kiddos that have airway? If their airway is compromised, that pacifier may actually be helping them move oxygen. So again, the pacifier may be helping them sleep and connect their cycles, their sleep cycles. But overall, I want a pacifier in when they're upset, when they need to be pacified. Beyond that, I want it out. I want that tongue suction all the way into the roof of the mouth, teeth closed together, lips closed, and nasal breathing. I don't want to see mouth breathing at all. I don't want to see, they're not really mouth breathing. Their lips are just slightly apart. If you're going to be on a passy, anybody can pay money to use buzzwords and marketing terms. Pediatrician recommended, orthodontist approved. That's just, you paid somebody money to put that on marketing. If you're going to use a passy, I've got a post on my FlourishCarolinaOT Instagram page with all my favorite. There's 6 of my top passies on there. I want a kiddo on a round passy. Most people know very well the round Soothie, the Avent Soothie as the green hospital passy. I want a kiddo on a passy that's round. I don't want a bulb at the bottom of the passy. I don't want the orthodontic or the flat bulb-like passies that allow them to sit up into the roof of the mouth and then the tongue presses into it. No, I want the tongue up, curled like a taco shell around that passy, waving like this. So pacifiers can be great trainers for oral function. Sometimes I use a pacifier in therapy to help them use the right muscles to get their tongue lifted. The mini passy is all the rave in the therapy world. I'm loving it. I'm stocking it in-house now because I love it so much. But it's a hard passy to hold and to keep in the mouth. So if you're kiddo, if you're like, I bought every passy on Amazon and they can't hold any of them in, or, we play passy pong back and forth, in and out, that's a sign of oral dysfunction. So I don't want a bulb-like passy. I don't want a flat-like passy. I want a round passy, and I want it in the mouth the least amount possible.
Love it. Again, individualized.
Yeah.
But definitely, one of the things that I see on social media is 3, 4, 5-year-olds, and why people need to understand why this is so important. Your brain doesn't sit very far from the roof of your mouth. Yep. So if you have a child 2, 3, 4, 5 years old with that pacifier, the roof of their mouth will not grow properly. It will start to grow around the pacifier, literally. So you're putting pressure through the bones of the roof of your mouth real close to the brain. So that soft tissue is getting smashed on up there. Again, any wonder why your child feels irritated and anxious all the time? So I love the idea is, yes, use it when needed. It's just like crutches, or it's just, like back braces or the harnesses that I see to correct your posture. You cannot wear that all the time. It's not protecting you. It's not building up anything. It's not fixing anything. If you're going to be unloading a truck of mulch and you don't usually do that, heck yeah, wear a back brace. But you cannot wear a back brace all day, every day. Your muscles will say, I have external support. I don't need to hold myself up. So love that individualized care.
That tongue suctioned up into the palate, that's our vagus nerve. We're seeing a lot of that buzzword on the internet and on social media. When that tongue is sitting up here, suctioned up into the palate here, and the teeth are closed and we're nasal breathing, we are regulating our nervous system there. So if your kiddo's mouth breathing, I know we're going to talk about this and maybe we just jump into it. These mouth breathers, you shouldn't be mouth breathing as a baby. Your toddler, your child, you adult, no one should be mouth breathing. No one. So when that tongue is not getting that stimulation, we are not getting the parasympathetic nervous system into regulation. So if we are looking groggy, if you are hearing snoring, huge red flag. That is a problem. No one should snore short of having, a cold, a viral illness. That's it. That should last for a week and then it should completely stop. Nobody should be mouth breathing. Nobody should be snoring. If we are seeing kids in funky positions where they have their necks cranked back, and their mouth open, if we're seeing drooling on the pillow, if we are seeing upside down, inside out, off the bed, hanging off, their sheets are a mess. I always say telltale sign is the hair. Even for kids that, boys that have short hair, it doesn't matter. If that hair's standing up or that hair's a mess and their sheets look like a tornado went through, if we are having fidgety legs, leg pain, if they sleep next to you or they wake up and you slept with them the night on vacation or they had a bad dream and came in to find you, if they're like sleeping next to an octopus that's like trying to find their keys, that's a problem. That is a sign of sleep disorder breathing. So those are the things we want to really check into in our older kids. That is built in infancy, the first 6 months. So your mouth breathers likely didn't just become, they didn't just wake up at 3 years old and become a mouth breather. They've been a mouth breather, or their tongue has been pulling down, not getting suctioned. Their adenoids could be enlarged. Their tonsils could be enlarged. So it's like chicken or egg, which came first? If the adenoids that sit kind of, I explain it to parents like behind the nose, above the tonsils, we can't see them without being scoped. If those are enlarged, that's going to create mouth breathing. Our adenoids are our filter for blowing our nose. That filters all the dust, the germs, the junk out. So if we're not nasal breathing and blowing our nose in the morning to get the junk out and those enlarge, then we become a mouth breather. Then it enlarges our tonsils. Well, guess what? All of the germs, dust, bacteria, viruses, everything in the air hits our tonsils and it spreads through our lymphatic system. So those chronically sick kids, the chronic runny nose, I don't want to hear, oh, they're a daycare kid. No, they can get a cold and it needs to go away. It needs to clear. They should not be chronically sick, runny nose. I go to my boys' school and I walk in and I'm like 1, 2, 3, 4, 5, 6, 7, 24, 28, 30. I start counting around the lunch table or at recess or in the classroom. And these kids are like this. They're just, tongue is sitting low, mouth is wide open. If your child looks like that at night, you need to find a provider. That is not normal at all. It's normalized. Oh, snoring, so everyone does it. Mouth breathing, it's no big deal. That's not. It's impacting our nervous system. It's impacting our digestion. I mean, we can pull in every system of how mouth breathing impacts it.
What do you think about mouth taping? Does that fall into your paradigm of care at all?
Yeah, so I am a huge fan of it when we know that the airway is safe. There are a lot of people out there mouth taping and they have not had a cone beam scan. They have not had any sort of testing to test their airway patency. We need to know what their airway looks like. Mouth taping can be dangerous if we don't know what their airway looks like. So we can be mouth taping, that's just closing lips. What if they don't have good nasal breathing? What if they don't have good airflow through the nose? Mouth taping is hurting them. So I do mouth tape with my oldest. We have had airway scans. We know why we're taping. We know his, airway is clear and it's safe and it helps him. We've done a dual sleep study 2 nights in a row, 1 night untaped, 1 night taped. His sleep quality taped, incredible. Do not just go tape just anybody because you see the tape online or you see that someone did it. Make sure you've had a myofunctional therapy evaluation. Make sure you've been scanned by an airway-centric orthodontist. I think mouth tape can be life-changing. It is for my oldest. If he doesn't sleep with it, we can tell. Like he feels it. He feels it immediately.
Yeah. Again, going back to how we as adults intervene for ourselves, just throwing orthotics in your shoes.
Right.
No, I mean, so why is the thing there? We have to do research. We have to do a little mystery dive into the body and how it's presenting the way it is. How do you, like you said, going back and looking over all of your cases, you cannot, I know you could never put a number on this, but like statistically, how often do you think a child is receiving a diagnosis for ADD, ADHD, all those other things, when it really comes down to a functional patterning problem that started in utero, that did this thing in its infancy, that's now presenting as these behavioral disorders?
95% of kids that walk into my room that have an ADHD diagnosis already listed, 95% of them have sleep disorder breathing or obstructive apnea, and no one's looked at it. I think it is criminal, absolute criminal in our healthcare system that we will medicate, treat, behavioral therapy, school interventions. Now, I fully believe in ADHD and ADD and inattention, but for kiddos that are not getting good quality sleep, how can they be attentive the next day? How? They can't. They're struggling. So it's the easiest thing to test and rule off. If a kiddo has ADHD or ADD, treat it. Absolutely. I would never, ever shame a parent, but I've had dozens of kids hop off medications. The medications weren't even working for them. When we discovered there was a sleep issue and we treated the tongue, they went into myofunctional therapy. I worked with them on breathing retraining and teaching them, does your tongue even know where to sit? Do you even know how to breathe? Do you know how to use your belly or your lungs? Most of them don't. Most of them, their posture is just rotten, whether they're tongue-tied or not tongue-tied. But I would say, I couldn't even put a number on kids out there that I'm not seeing. I mean, they're saying 95% of kids that have an obstructive sleep apnea diagnosis, that they were never diagnosed. Like, it took for the parent. These kids are rolling around. 95% of kids are rolling around out there with obstructive sleep apnea, and like, people don't even know it. And it's the easy thing to check.
Just medicated.
Yeah.
Yep. Very scary. So talking about sleep, obviously, if you can't breathe, you can't sleep. How can we start to help parents formulate a game plan to, obviously, very first is getting the occupational therapy and getting looked at for the structure, but actually in the home, in the habits that we have, in the lifestyle game plan of how our evening looks, how can we start to help parents build a routine to make sleeping a success? Because it should be the end of the day, everybody's coming together and, having this wonderful time, not crying and screaming every single night. So how can we start to lay out some practical guidelines and tips to help sleeping be more successful?
So I would say, I always empower parents, physically check their sleep. If they are not leaving their room, we often don't know what their sleep looks like. So I send every parent out with a checklist. I want them to go check, off multiple things: their positioning, their tongue, their mouth. Are they on their back, belly, or side? Are they sweating? Are they upside down? Are they grinding their teeth? I tell them, like, you're the investigator, you're a detective. If they are like, I'm not interrupting my own sleep to go check my kid's sleep, suck up the EMF for a night, throw your Apple Watch, throw your Fitbit on. I had a mom that I went round and round with. I was like, I am telling you, I would bet you $1 million that she has sleep disorder breathing. I think that this is a sleep issue. I said, go and just throw your watch on her. She texted me the next day. It was 7%, only 7% of like quality sleep. Out of a 10-hour period, it was like 2 hours that she properly went into sleep cycles. I have a friend in Ohio, same thing, text me, Bri, I saw one of your Instagram posts or a story or something about sleep. Throw your Apple Watch, throw your Fitbit on him. His sleep for 3 nights. I mean, after the first night, I was like, girl, we know what's going on. I said, do it 2 more nights just to make sure it wasn't an off night. By night 3, she woke up, she was like, no wonder behavior's off. No wonder he's a mess. So first, let's be detectives. I want parents to feel good about saying, oh my gosh, I agree. Like, their sleep is off. We need to investigate that, because then parents want to buy into it. We want to solve it then. There is such an emotional piece to sleep. And a lot of times we are being told, treat it behaviorally. I was told literally in a my chart message, spank them and lock the door. I have it in black and white writing. I was at in desperation. We took beds out. We threw a mattress on the floor. There was nothing in the room but a mattress and a pillow and blanket. I have selfies like mocking my kid asleep on the floor on the mattress, being like, here I go. Like, he's half out. Now I'm going to sneak out of the room. And I literally went to therapy over what I was doing to my own kid's sleep because I was so desperate. I mean, I was waking up the next day. I couldn't function. And it was like the amount of times I wanted to just shake them and say, go to sleep. And I kept saying, like, they're not doing this to me. Like, they need help and I need to find them help. So something I think we forget about when we're tired and we're irritable as the adult is going back to the basics. Routine is everything. Routine is everything. I'm a huge, big, fan of scheduling kids from early on. When they know what is expected of them, when they know predictable nighttime routines, evening routines, sleep, they know what's expected of them. And their body knows. So if we don't have a consistent bedtime, That's a huge problem. That's a problem for them as an infant. That's a problem for them as a big kid. Now, we have sports, we have after school curricular activities, we have screen time, we have all of these things. I'm a mom, I'm a working mom. I get it. I gave advice. I feel like I need to write apology notes to people that I gave advice to before becoming a mom. Because I'm like, oh, do this morning routine and do this evening routine. I'm like, take a shower, get your tail in bed, let's call it a night. But routine is so important. So if we can get kiddos, let's start in infancy. Before we are sleep training your baby, check their feeding. Are they getting enough ounces during the day? Are they night waking because they're actually hungry? If we are sleep training a hungry baby, we are telling them, your nervous system, the message you're getting from your brain, shut it off, ignore it. So while I love sleep trainers, I work with some very good ones. I refer to them frequently. I need to know, most of them that I refer to, they come on my side of understanding ties. Most of them, they've experienced it as moms as well, and their own kids. And they're like, how do I even give sleep consultant advice when, my kiddo is struggling with feeding and airway? But getting that routine is huge. Having predictability. So in infancy, in that same crib, that same sleep environment, I want it dark. I want it cozy. I hear a lot of older kids, they sleep with their closet light on. I'm like, what? You cannot have your closet light on. That is keeping your brain awake. Even little lights like smoke detector lights or camera lights. You can take a tiny piece of dark, electrical tape and cover just that light. Do not impact your smoke detectors and your cameras and things like that. But if that little light is enough to bother them, especially bright lights, these bright green and yellow, get them out. Relaxation before bed, whether it's just a quick wind down time. Can we do a quick snuggle? Can we read a story or read a book that helps the kiddo wind down? If we are just quickly getting them out of bath or out of dinner, their nervous system didn't get time to wind down. So screens 90 minutes before bedtime, don't do it. It's keeping their brain revved up. So if we can, decrease lighting, get them into a calmer environment, get, your dinner, if you've got dimmable switches, like start bringing the environment down. Because I say to parents, I know as a mom and a dad and a parent, you're trying to just get them to bed. But how do you do if you go, you responded to emails and texts, you did all of these things, and then you hop into bed, your brain's like a pinball machine, bing, 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 bing. It can't calm down. We don't expect our kids to do that. So they pulled out, I need a drink. I'm still hungry. I forgot to tell you something. That is the behavioral aspect that they're pulling, wanting support and connection to help fall asleep. I love to do meditation or to do some breathing and some body awareness. So these are easy. You can quickly Google these or message me. I can send you some strategies. Just bringing awareness to the body, having them close their eyes. Maybe you play some music, some classical music. Maybe you don't, a lullaby, whatever they like, but telling them, I want you to squeeze your toes hard and count to 5 in your head, or I'm going to count to 5 for you. We're going to go up to your ankles. I want you to try to squeeze your ankles. I want you to squeeze your knees. Often you get giggles out of the toddlers, right? Or the bigger kids like, Mom, this is so silly. What are you doing? But it brings regulation to that nervous system. It brings that balance between parasympathetic and sympathetic, and it calms them down. It brings them back to their body and in touch, in tune with themselves. Going over your schedule in the evening. Are we overpacking it? Are we running into bedtime? I'm kind of ridiculous, and I pick what nights my boys, I know I won't be able to do that forever, but I pick what nights they do activities that I can make up for that sleep balance the next morning by 30 minutes. Or we're not doing something on Sunday night, Monday night, Tuesday night, and we're going to stack things later in the week. Whatever works into your family, but really monitoring the screen time, monitoring, evening routine, and then, take them back to infancy. I'm not saying take your 12-year-old in your lap and rock them. Some of them may really love that. My 7-year-old, I think I'm going to rock him till I'm 100. Loves that touch. So find out, what does your kiddo need? Do they need a back rub? Do they need some light music? I was so triggered for so long. I still lay with my boys. It goes against all the books. All the books say, gradual extinction and let them fall asleep on their own. I have found that time with my boys is what means the most to them. We haven't seen you all day, Mommy. You've been at work. I want to talk about my day. I want to connect. We listen to some music that helps work some nervous system. It's targeted for relaxation, very specific. It's a specific app that we use. And I used to get so frustrated by it. And now I embrace it to say, number one, they're not always going to want me in there. And yes, I have things to do. I need to clean the kitchen and respond to emails. And half the time I wake up and I'm like, well, it's 6 a.m. and I, fell asleep at 7 with them and I have reports undone. I'm still in my work clothes. But getting that consistency, connect with them, ask them, what do you need to help fall asleep? Maybe it is a nice cold glass, a glass of water and some cuddles, but work with them, because I promise you, they're not causing you grief over sleep. Like, they're not doing it as a behavioral problem. Maybe they need some connection and attention. Let's get that during the day. If they're seeking that, they're doing it for attention, then we need to find some one-on-one time and figure that out together as a team. But our bodies, we are not wired to just cause problems. We need something. Figure out what they need.
Yeah, like I said earlier, our bodies don't do anything abnormal just because. It doesn't just happen. It does just manifest. If your body's doing something out of the ordinary, it's simply a communication skill or attempt to communicate with outside resources that need something a little bit more. I love the tactile, real world, physical component of all the things that you just said. And for parents, like with my clients, I teach my clients to body brush, because some kids don't like the cuddles. This is huge in like the autistic community and other communities like that, the non-touch children. They don't like to be touched, but a lot of them love to be body brushed because you're stimulating different nerve pathways that can be very calming to the nervous system. And what I tell them is, I think it may be especially with boys too, it's hard for them to ask for a hug or a cuddle. And so if you have another outlet that they know is available to them, that they don't have to say, Mom, will you come cuddle with me? Or will you read me a book? If you have a thing like a massage gun with a soft foam attachment on it, some version of tactile communication to that nervous system, like you said, is even a minute or two, doesn't have to be a long time, something to bring them back to themselves and their body. Again, goes back to setting that precedence where it's not genetic, it's familial. And I'm, like you said, with your schedule, you intentionally choose what you are going to allow in your evening routines 4 nights in a row. So setting those intentions and having options available, again, because we are just big kids. We need that ourselves. If we're on rung 10 of a nervous system going to bed at night, are you surprised you can't sleep? So you got to walk yourself down just like they need to walk themselves down, even more, because they're having flushes of hormones and they're having a growth spurt and they cut a new tooth, or like all these other extenuating factors that we don't even have anymore. And we're actually more of a problem than they are half the time. Yes, it's a lot of great tools and techniques there to really help people get a routine in place so the kids know what's going on.
How is their room set up? Is it set up for sleep? If their room is chaotic, they're not going to be able to shut their nervous system down. So I'm very, very big on working with families. There are times we have to say like, all right, I need you to record what the room looks like, or we're going to FaceTime and we're going to clear some of this out. Like, I don't know where you have to put the toys, maybe in the closet, maybe move them to another room, the bonus room, the living room. They need to go somewhere, because the bedroom needs to be a place for regulation, to get that body ready to shut it down, not to rev it up.
100%.
I happened to wash my hands with like a lavender soap at an appointment that I was at, and I came home and my son was like, oh my gosh, your hands smell so good. That makes me feel so calm. And I was like, whoa, I didn't, of course, essential oils and scents and different things, but I'm not going to go dump it all over his room. But something as simple as like what I'm using on my hands as I'm giving him some input, or just, rubbing his head and talking about his day. That's another part of our sensory system, just giving some good calming feedback. It can be so helpful.
The essential oil is another technique that I tell my clients. Again, it's like, and kids don't even maybe know that they need to be asking for physical touch or care, because they haven't been taught. I mean, we have half the time don't learn how to ask for that as adults. Right. So, you have your body brushing they can ask for, massaging they can ask for. If you have 5 or 6 different blends or scents of essential oils, that's a thing you guys can do together at the end of your day, and you can put it in the diffuser together. They can pour the water in. They feel like they're part of something. They feel special. I feel like extra sore today, so I'll put this oil, this magnesium cream on your muscles or something. and they're getting all those good tactile interventions and communication and bonding without having to specifically verbalize, I need some extra attention today, mom or dad.
And I think
Yeah.
it's like, we like, oh, our essential oils and oh, the scents and oh, rocking them or cuddling. But really, those are foundational needs as a human. And our busy lives often negate those. Like, we don't have time for that. And I get it. Again, I tell all parents, like, I'm a working mom. I understand. When I type reports, I tell them, give me 24 hours to get your report because the likelihood of me falling asleep with my voice is high, and I'm just going to own it, right? But I think it's just going back to those little things for kids. Maybe you don't need the lavender for you to go to sleep as an adult, but that might be something that really helps your kiddo. So connect with them and figure out what makes your body feel good to help you sleep.
And it's never a matter of doing it this specific way or this many times or amount. It's just like eating healthy. I tell my clients all the time, you never win at eating healthy.
Right.
You never get to stop doing it.
Right.
And having these things built into your family changes the trajectory of your child's lived experience as an adult. So it's not that you're going to do it right every night. It's that you're going to try something on a regular basis. That's the win.
Yes. Again, predictability and routine. Kids thrive off of that. Something you mentioned too, hormones and different things that are happening in the body. And that is something I see so often and very misunderstood. I have lectured on this topic multiple times on, our melatonin. When our body is getting the information from dim lights and a relaxing environment, that helps our body produce melatonin, which is what winds us down. If we are not breathing correctly, our melatonin, serotonin, cortisol cycle is interrupted. So for you, those of you that have kiddos that are waking in the middle of the night or consistently, they're a 2 a.m. waker, they're a 4 a.m. waker, we need to look at what is their hormone cycle like. If they're mouth breathing, it's going to interrupt that melatonin, which helps them fall into that good deep sleep. We go through 4 sleep stages. We want the body going through those correctly, not jumping around, not missing deep rapid eye movement sleep or non-REM. So if our melatonin is wearing off early because of frequent waking and mouth breathing, that's going to increase our serotonin, which is going to it's going to make us wake earlier. So all of you with early risers, what is happening to that melatonin, serotonin production? And then our cortisol level rises. So those of us in adults and, we're aging and hitting menopause, like everyone's talking about our cortisol levels. Well, our stress and our adrenals, right? But what's happening at night? What's happening in our sleep and our airway? So our leptin and ghrelin, those are our hunger and our fullness, that if we are mouth breathing or we are not getting into that correct melatonin, serotonin cycle, it's going to impact our hunger. It's going to make us hangry. It's going to make us crave typically carbs and sugar because we didn't get good sleep the night before, which is where I kind of, when we're connecting on social media and kind of busting myths, it's the snowball effect, right? We're commenting on, it's a sleep issue. It's a behavior issue during the day. No, we need to check sleep. Now we need to check those hormone levels. Now we need to check nutrition. What are they eating? Are we filling up enough? Just like a baby who's not going to sleep, not getting enough milk. Kids, if we're not getting enough quality nutrition, we can get empty calories all day long. That nutrition is vital for us to get good quality sleep. So our body can rest and digest and repair and then start the next day all over again.
100%. It's a full picture that's needed. There's never only one thing that caused it, and there's never only one thing that's going to fix it.
Right.
I always tell people, if your doctor says, or whoever you're listening to, if you have to do this is going to fix that thing, just find another one, because there's never just one answer. We could probably talk for another 5 hours, but I know we both have kids and families we need to get to. I have one last question. But before I ask you that question, are there any other big myths that you want to bust or big pain points that parents have or kids have that you wanted to bring out before we go to that last question?
I mean, I feel like we talked about a lot of them. Like, don't normalize it. If your gut as a parent, I always say your mom gut, your dad gut, like, it's not wrong. And if you are sitting here and you've been told, they'll grow out of night wetting, they'll grow out of snoring, they'll this, they'll that. we're compensating. So you're doing a great job as a parent. I want everyone to listen, whoever is listening to this or watching this, you're doing a great job. This is the hardest job on the planet, being a parent. And, we all can go back, coulda, shoulda, woulda, like know better, do better. When you know more information, then we can do better with that information. So you're doing a great job. This is hard. And sleep and feeding. I mean, I deal with the 3 hardest topics: sleep, eating, and pooping. Like it creates so much stress at home. So if your gut is telling you something's off and you're being dismissed, dig for answers, reach out, don't stop. A lot of times I get parents like, oh, we've seen a gazillion providers, and there's a reason. There's a reason that you're, going through providers and you're not being heard. Don't stop. Get your kiddo help, because we want everyone to grow and to feel good. And a kid or an adult who's never gotten good sleep, you don't know what good sleep feels like until you get it. And that, I feel like, is such a gift. If I could give a gift to everybody, it would be putting a good night's sleep in a box. I want them to sleep good so they feel good.
So my last question is, and it kind of goes back to like how I started. I'm helping adults every day in my career manage stress. And a lot of times it's the mother, because she's so strung out, doing everything for everybody. With all of the families that you've worked with, how important is it to have both caregivers, if they're available and present, to have both caregivers participating and having an active role, especially when you have a lot of dysfunction or a lot of circumstances around, how the mouth is forming and all that? How important is it for long-term success of the child and the marriage for both to be on this path together?
It's non-negotiable. And I see a lot of families, I don't feel like I have to sell my services a lot, or, once I get a parent, say one parent comes to the appointment or a single parent, if, I'll tell parents, start recording, voice record or video record me. I just simply ask that they don't share it with the next family, because my advice to this child could be opposite for the next. But I want that parent. I do tons of voice messages to families. I'll call and do a FaceTime or a voice message to a parent. Send me an email. I need the house. It's a unit, a family unit. This cannot be, we're going to have this bedtime routine for this kid, but not for this one. It needs to be a family routine. And that's hard. That is hard in today's society, with outside, extracurricular activities, with sports, with working parents, with managing a household, with commute time, with household demands. Like, it is a lot. And I feel like as parents, we're often guilty of do everything for the kids and kind of just whatever is left over for us. But if we're not sleeping, and that's what drove me into like, I'm going to figure this out with my kids, because I'm going to go crazy. Like, I'm waking up, I'm like putting on a mask, I'm going to work, and I'm acting like I'm functioning. And I didn't know how sleep deprived I was until I started sleeping again. And I look back at those times and I'm like, no wonder I was yelling at my kids. No wonder they were irritable. Like, our whole family was in disarray, and we faked it. Our Christmas cards looked great. I showed up to work looking great. I'm giving advice that I couldn't follow in my own family until I started digging and uncovering these things. So, one of my favorite books, Sleep Wrecked Kids. For parents, this book, it walks you through. So, it is like the sleep, like it should be plated in gold. It will walk you through everything. It will tell you and help you find, hey, this might be a problem. Let me dig into this. For listeners that are not in the Charlotte area, reach out to one of us, on Instagram. We'll help connect you with a provider. I'm part of a lot of, directories, and we can find somebody who gets this. We can help you virtually if you see, or give advice virtually. But the family unit, it has to be together. Or if there is one weak link in that, everybody's sinking. And it's, it takes the nervous system of one person to be frazzled to set the tone in the household. And I used to hear this and think like, oh yeah, all right, that woo-woo stuff. And, like some days, we'll be balanced when I have like a maid and a chef and a taxi and all the things, but it starts with our nervous system. It starts with our breathing. And there's so much, if you can regulate as a parent and tackle into our hug timer is going off. This is part of our family regulation system that we have a 6 o'clock hug timer. We stop whatever we're doing to hug. So if you heard it in the background, that's what that was.
I love it.
But that's what starts our evening routine is our hug timer.
Love it.
It stops whatever they're doing. And we reconnect and we finish up what's, needs to be done in the kitchen and pack lunches. But, meet with your partner, with your spouse, like sit down as a family and figure out what are we missing? What do we need? And try it. If you keep doing what you're doing and it's not working, you're going to get the same results. Try something else.
The fact that your hug timer went off during this episode makes me so happy.
I shut off every timer on my computer. I made sure my phones were on airplane. I did everything. So I was like, my Mac desktop in the background, is that going to go off? What? I put a note on my doorbell that said, do not ring my doorbell, but that hug timer. And my boys are probably upstairs giving my husband a hug because it goes.
Perfect. Yeah. Can't think of a better way to end this podcast. Yeah. Everybody should get a hug timer. Thank you so much for your time today, Bri. I appreciate it so much. I'll be sending this to all my clients, but thank you for letting us know that no matter what, no matter how we got started, no matter what our health history is, no matter how bad the symptomology is right now, what we're experiencing, there's absolutely 100% a way to come through it and even thrive in our physical, mental, and emotional well-being. So thank you so much.
Thank you for having me.